Hi there, how may I help you?
Hello. I've got a problem that I've had for about a couple of weeks now. Basically, when I go to the toilet, it stings.
Okay, so when did you first notice this?
I mean, it's been going on for about a couple of weeks now.
Okay.
I think it feels like I might have a urine infection or something like that.
Alrighty, and have you noticed any colour change to your wee, or apart from that, any belly pain?
No, there's
Nothing
no
like that?
pains or anything like that. No
Okay.
colour changes.
Okay, you've not felt unwell in yourself at all, so had a fever or a headache or anything like that at all?
No, everything else has been fine.
Okay, and when you look at your own genital area, any changes down below that you've noticed?
No.
Okay, and can you tell me a bit more about any changes elsewhere in your life? So have you had anything else going on? Have you had a change in relationship recently?
The doctor here appropriately starts asking questions to do with the social history. However, it may be worth introducing the reason for asking these questions before you do so. One of the ways you could approach this would be by saying, there can be lots of things that can cause symptoms like burning when passing urine, including sexually transmitted infections. Would you mind if I asked you personal questions about your current relationships?
I get the feeling, I slept with a woman I didn't know a month ago. I met her at a party. I don't know anything about her. I'm not in contact with her. Before that, my girlfriend, we broke up about 3 months ago. And then about a year ago, I was with a woman for about 3 months, but that's ages ago now.
Okay, so you've had a couple of relationships over the last 12 months or so.
Yeah.
You've mentioned your girlfriend that you were with for about 6 months, the lady that you've also been with about a month ago.
Yeah.
And then somebody about a year ago. And with these partners, did you ever use protection or condoms or anything like that at all?
I did with my girlfriend, but with the woman I slept with a month ago, no.
Okay, okay. And is that anything that's worrying you? Is there anything along those lines that you're concerned about at all?
Yeah, I have a feeling it might have something to do with that.
Okay.
But I'm just hoping it's not something serious.
It's good the doctor picks up on the cue here, which allows the patient to voice his concerns.
All right. Have you ever had any screening with regards to any sexually transmitted infections or anything like that at all in the past?
No, but I did have a friend though,
Yeah.
who had a similar issue, but he didn't get checked. He can't have kids now.
Oh gosh, that must
So
be
I'm
quite
just-
concerning for you.
It's good the doctor acknowledges the patient's concerns about his friends in this section.
Okay. Have you ever had any other troubles with your bowels or anything like that at all?
No, nothing.
Okay. Well, it certainly sounds that you've got a couple of concerns. You've mentioned the thought that it might be a urine infection, which it might be. In younger people, it can also be other things, and you've mentioned about your friend, and I think it would be sensible to maybe check that out as well.
Right.
Part of the way of assessing this would include not only checking your urine, so we'll get you to bring a sample back if you haven't brought one with you today, but also I would normally try to examine your genital area, so down below. As there's a gender difference between us, I'd normally have a chaperone to do that.
Right.
Would that be all right with you?
I mean, I'm not keen on it, but if you need to do it, I suppose I'll go ahead with it, yeah.
Why are you not keen on it?
I've never had it before, to be honest, and it's a little bit embarrassing, isn't it, I suppose?
Yeah, well, I mean, it's not embarrassing for us. We've done it lots of times as doctors.
Yeah.
But certainly there is reasons that we would need to go down that route, and that would include making sure there's no skin changes on your penis or testicles, because sometimes skin changes or lumps and bumps can also cause you to have the symptoms that you've mentioned.
Okay.
All right. Would you be okay to go ahead then?
Yeah, I'll go ahead with it.
The doctor clearly explains the reasons for the external examination and for a chaperone. She recognises that he has reservations about the examination and addresses these before obtaining consent.
Right. So the good news is when we've examined you, there's nothing that's really gone on. There's no skin changes to your penis or testicles that are worrying. Okay. The urine that we've checked for you also just shows some cells, but nothing in particular, and a bit of blood. Now, there's lots of ways of going forward with this, because that doesn't really give us a clear idea of what's going on. So it doesn't show that you have a urine infection. The other thing that we were talking about briefly before we carried on was thinking about sexually transmitted infections. Now we could test for that, and there's different ways of doing that. We can do that here at the surgery, and that involves sending your urine off to test for 2 infections. They're called chlamydia and gonorrhea, and we'd normally also do a blood test. Now we can do that here, but you can also go to a specialised clinic if you'd prefer that, and they can then do further tracing with regards to if anything should come back. Do you have any thoughts about what you would like to do?
There is a good demonstration of a patient-centred management plan here. The doctor gives the patient the options in terms of where he wants to have his tests done.
Oh, can I get it done here?
That's no problem at all.
Yeah.
What we'll do is I can send a urine sample off, and then I'll do a form and I'll get you to book in with the reception staff to have a blood test, and we'll get you back in about a week to make sure that we get the results.
It's good the doctor has arranged an appropriate management plan and follow-up here.
Obviously, because we're not sure what the diagnosis is at the moment, I'd normally advise you that if you are going to be sexually active, just to use condoms in the meantime, or try and abstain if you can.
Okay.
Do you have any further questions, or would you like any further information about what we've discussed about today?
No, really. I did wonder about getting an STI screen, because I know that's supposed to be quite helpful. Do you know anything about it?
Yeah, that would be part of what we were doing. So the blood test and the urine test would be the STI screen.
Is that what it is? Right,
Yeah.
okay.
It's good the doctor asked here if there were any other questions. This allowed her to acknowledge his understanding of the management plan. It also gave the patient the opportunity to be clear about what the tests were for, especially with regards to his concerns about STIs.
All right. Any other questions at all?
No, that's all.
All right. Thank you very much then. I'll
Thanks
give
very
you
much
this.
for your help. Cheers.
No worries. Bye.
So how did this doctor do? Under interpersonal skills, she was very approachable, listened to the patient and addressed his concerns, and these were very good. In terms of data gathering, it would have been good to include a little bit more information about other symptoms like penile discharge and red flags like hematuria, and maybe even explore social history a little bit more detail. Her management plan, however, was appropriate, patient-centred as we've already mentioned, and overall I would grade this consultation as a pass.
For now.